I'm Von Biggs, and let's queer up health. LGBTQ plus adults less likely to get HIV tests in states with refusal laws. A growing number of U.S. states are enacting laws that allow healthcare providers to refuse treatment based on personal or religious beliefs. New research shows measurable health impacts of those laws on LGBTQ plus communities. As of April 2026, 11 states have passed conscientious objection laws that specifically affect queer patients. The conversation analyzed data from over 109,000 adults collected by the Centers for Disease Control and Prevention between 2016 and 2018. It found that lesbian, gay, bisexual, and queer adults living in states with refusal laws were 28% less likely to report receiving a first-time HIV test compared to peers in states without conscientious objection laws. No similar decline was observed among heterosexual adults. The study also found that LGBTQ plus adults in those states were 71% more likely to report being in fair or poor health after the laws were enacted. Researchers identified these disparities by comparing changes in health outcomes before and after the laws took effect across multiple states, isolating the impact of the politicals from preexisting differences. The findings come as additional policy changes affect LGBTQ plus healthcare access nationwide, including reduced funding for HIV programs, limits on gender-affirming care, and legal exemptions allowing employers to deny insurance coverage for preventative medications like PrEP, HIV pre-exposure prophylaxis, or PrEP, can lower the risk of contracting HIV from sex by 99%. However, patients need to receive an HIV test before PrEP can be prescribed. If providers refuse to engage with queer patients on their sexual health, people who could benefit most from PrEP may never receive it. Oh, take a breath, right? It's very interesting because I look at this, and when I look at the data, when you look at HIV and transmission rates, it's actually our heterosexual communities that are increasing in acquiring HIV, and it's our LGBTQ individuals that are decreasing in transmission rates. So while they're coming after and they're saying they can do this, well, we all agree it's wrong. This is where I look up at you and go, find another doctor. It's time to find another healthcare provider. If they're not able to have your healthcare back in your case, it's time to find someone who can. And it doesn't mean every doctor is going to do that. There are other ways to get PrEP. There's clearly other ways you can do it online. There's a lot of things you can do through telemedicine. So I think there's definitely opportunities for that out there in the community.
Well, this is just putting numbers to legal fag bashing.
Right.
That's what this does. Any doctor who refuses care because they don't like the queers or they have religious exemptions should absolutely have their medical license revoked. Full stop. You should not be prescribing medicine. You should not be treating patients. You're a terrible person. I mean, I'm sure it goes back before this, but in my mind, I remember after Obamacare passed and Hobby Lobby, those self-righteous little, I'm not going to say the C word, but your C words. But no, they started this. It's probably started with abortion. Oh, your company doesn't have to provide abortion coverage payments. Then Hobby Lobby comes in and makes it even worse. Contraception, PrEP, things like this. So these little companies that try and put themselves out as the face of Americana are really the rot of Americana.
I question the conclusion of the findings, right? I have yet to hear of a case where a doctor says, you have HIV, I don't want to treat you because you're gay or something like that. I think it's more that if you are somebody who is maybe on the down low, or you are just scared that you're going to be found out for being gay, or that you may have HIV or something like that, when your state enacts those laws, you realize, wow, I'm in an environment where people are really going to stigmatize me.
Right.
And I can go back to my own story, the first time I ordered an HIV test, which I didn't think that there was anything, I hadn't engaged in risky behavior to where I thought I would get it. However, I definitely did not want to go through my healthcare provider because just in the chance that I did get it, I didn't want this to be on my record at the moment until I figured out what I would do with that information. Because it's really scary to know who has control of knowing whether you are gay or whether you have some kind of disease, you know. One, for insurance is to be able to deny you potentially. Now it's a little different with Obamacare, but before, at that time, you know, they could deny you for anything, you know. And who finds out about this information? Is it just your doctor? Is it the people who are working at the desk that can see? And if you live in a small town, like I did, everybody knows everybody. And so the moment that these tests go through, they're like, oh, so-and-so is getting this test. Oh, I never thought that they might be gay. Oh, it's HIV, you know? So there's a lot of stigmatization that happens, and why people choose not to go to their doctor or to have these tests done, you know, with their, in the whole healthcare system because of privacy, when you think people are out there to get you.
I worry because this adds one more obstacle, one more barrier to care, right? And I think there have been studies done that people who are not, or rejected, or not given care are less likely to then go and follow up with care or to look for care. And we're talking about HIV, you know, so this increases transmission rates. So it's just a really terrible obstacle to care.
Part of the amazing thing too is people can get an HIV kit mailed to them. So it's like you can do it in the comfort of your own home with an oral test. So there's always other ways around this, and I just want to empower people, if they hear this and they're in one of those states, that there's other ways to get this done without having
sign up for Grindr. It's right there on the page. Like, you can order a test at home. Nobody knows what the outcome is except you.
And that way you know what.
You on Grindr?
Yes, I am.
Well, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.